I'm Nsedu Witherspoon, and I'm the executive director for a national nonprofit called the Children's Environmental Health Network. And I usually ask folks to just, if I throw out the word environment, what are the top 3 things that come to mind, quick? And of course, there's no right or wrong answer. And then I'll usually just do a quick round robin and see what some of the answers were. And it's funny, whether it's before graduate, PhD students, public health students, healthcare professionals, policymakers, it doesn't matter. 9 times out of 10, you'll hear about, of course, air, water, plants, trees, all kinds of wonderful things. You might hear about animals. You rarely hear humans come to the top 3 when folks talk about environment. And I just want to implore upon you, this continues to be the nexus of my work. The connection or disconnection that we still face in this country in particular, with folks understanding that the environment that we spend a majority of our time in, our indoor environment, our built environment, our chemical, our biological environment, all have a direct response, positive and or negative, on our health and well-being. And that continues to be the nexus of our work, and particularly when we drill down to children and vulnerable populations, that's critically important to look at where they're spending the time and where those exposures are, and of course eliminating or at least reducing those as much as possible. And so I think that this quote from our Health and Human Services Secretary also taps right into that. But I like the very first part of that, that every American really deserves to have a clean, safe, and healthy environment. That's our premise at the Children's Environmental Health Network. We just celebrated 20 years of existence. We were one of the first groups to really kind of coin the term children's environmental health. Our initial demand came from healthcare professionals, in particular pediatricians and nurses out in the San Francisco Bay Area that were seeing a lot of young patients. And they were misdiagnosing. So they were seeing lead poisoning, what we now know to be lead poisoning. They were seeing severe asthma and the connection to air pollution. They were seeing pesticide exposures, especially in the agricultural communities, mercury contamination, and on and on. And they were recognizing, they're like, look, we don't get this type of information in medical school and nursing school. And generally speaking, that's still the case today. Generally speaking, we've done some good tread work there. But our basic mission has been the same for 2 decades, to promote the safe and sound environments for all children. We believe every single child has a basic fundamental right to have the opportunity for a nurtured and positive future. And it's very challenging, not impossible, to do that when you're sick. And of course, unbeknownst to you, and you're sick maybe from birth at times. Our 3 goals to achieve that mission are to promote sound, peer-reviewed science. So we don't conduct the science, we're doing a little bit here and there, but we're promoting it, we're trying to find the funding and appropriate for the funding so that those various research entities can get the sound science that we need in the advocate community to then move into the work of educating, of training, of empowerment of our communities to act, which is the 3rd piece on promoting safe child protective policies. And mostly our work is at the federal level, but certainly we advise and provide technical assistance to states. So we work to advocate for the first research national agenda. There was no agenda really for dealing with children's environmental contaminants 20 years ago. Thankfully now the EPA has a very core agenda. The National Institute for Environmental Health Sciences at the NIH conducts some of our most amazing world-renowned research in the field of pediatric environmental health. We help to establish, there are now 10 to 12, I wish we had more, but with funding that's what we have, research centers of excellence now, specifically devoted to looking at pediatric responses to air pollution and asthma, and endocrine disruption, and pesticide exposures, and the growing connection to various types of cancers. So when we look at children's environments, again, I just want to implore upon you, we have to look at every place where the child is spending time. The sad reality is that majority of us spend a lot of time indoors. 90% of kids spend 90% of their time indoors. So the indoor environment, which we know has some of its own unique aspects, has to be looked at specifically in relationship to the outdoor environment as well. Our children today may be the first generation to see shorter life expectancies than the parents before them. That's unfortunately where we're at due to poor health. So again, not assuming we're all at the same place here, why even are we focusing? Why would there be a need to focus on children's environmental health specifically? Children are very different when it comes to males and women and adults. They suffer more harm from environmental exposures, generally speaking. If we were to close the doors here and tune in some type of pesticide and to test all of us a couple months, weeks down the road, and to continue doing that on a regular basis, odds are the youngest kids would have potentially short to long-term impacts. We might not fare as badly. We might have some irritants here and there, but theirs are long-standing. There's a latency effect when it comes to kids. Usually their systems are still developing, so if they're exposed to harmful chemicals that were never meant to enter the human body, mind you, and their bodies are trying to churn and make sense of this, they have a longer term now for the rest of their life to digest this, and unfortunately for the negative implications to really hone in and make a negative outcome for that child. Also, what are kids doing? Their behavior patterns, they're on the ground as they should be. They're exploring. They should be. They're putting their hands in their mouth. Unfortunately, that's another route of exposure. While we have come a long way, we obviously have a long way to go. Over the last 50 years, as Brent has talked about too, we have over 80,000 new synthetic chemicals introduced in our environment. So with our nuances of our computers and our laptops and our cell phones and all those conveniences, there is a downside. Again, the asthma prevalence has increased dramatically over the last 3 decades.